All right, so it's budget vote time. Health Minister Dr Joe Phaahla has presented his latest policy and budget speech. The budget allocation is 64.5 billion rand, of which 86% will be transferred to provinces. He spoke about vaccines, the NHI, the fight against AIDS, that of course was set back by COVID-19 and much, much more. We're now joined by Health Minister Dr Joe Phaahla. Thank you for being with us, Minister. You said that the health budget, it sounds like a lot, but it will be going down by 1.7% every year. That's not even in real terms factoring in inflation. Have you been wrangling with Treasury over this?
Well, that's a perpetual struggle, for all of us. As you would know, every year various ministers and departments make their bid to the National Treasury. We have made our case and motivated, but of course we can only be able to be allocated within what the national purse has collected. So we are hoping that just like maybe this current financial year and the year we just passed, that there may be some better collection so that we could get a better allocation. But otherwise, if the allocation remains as projected in the next 2 years, then it's going to mean a lot of difficulty for us to be able to sustain just the services which we are able to provide now, and not to mention any further challenges in terms of the risks of pandemics and any other risks which may come on our shores.
Sure, that is incredible, Minister. For many, it's not about the spending, but how the money is spent. And this sounds like a lot, and this is going to be very simplistic or crude because obviously it's a huge system. But why, when billions are spent, maybe it's not as much as you would have liked, but why, when billions are spent, are we reporting recently on things like pregnant women sleeping on the floor at Rahima Musa Hospital in Gauteng, a bread shortage at Baragwanath? Can you give us your perspective of why things like that are happening? Well,
let me just say the whole public health system, it's indeed, as you've introduced the topic, a very huge, a big machinery which consumes a lot of resources. Just in terms of, some of our institutions, you would find that, for instance, some of the big central hospitals, increasingly over time, you would find that because of the diminishing allocations. On one period, I was talking to one of the CEOs, and what had happened, for instance, was that over time, they would spend maybe about 60% of their allocated budget just on salaries. But because of the reduction in the allocation, but the fact that, for instance, salary bill keeps going up, they were now at the stage where from 60% of the budget, the salaries were now at approaching 70% of the budget, just as an example. And then you still have to buy medicines, consumables, maintain equipment, maintain the buildings and all that. So it is quite a huge and cumbersome system. So it is important to maintain it at a particular level below which then it becomes difficult to actually sustain an acceptable level of service. Yeah. But of course, we also must accept that there could be better efficiencies in many of our situations as well. There are areas where there is leakages in terms of how these budgets are spent, especially in the area of procurement of goods and services. We know that, there's no secret within the audits and many other cases which are public knowledge. So there are improvements which can be done to still make sure that the resources are used optimally.
Well, what are you doing? Your budget speech said there will be an improvement in the quality of services. How? How's it going to happen?
Well, at a number of areas. One, we have identified the areas where various levels of improvement need to happen. One is just at the level of financial management, making sure that there is more, starting at provincial level, at institutional level, that there is adequate delegation of authority, but with supervision, and that people are held accountable. But firstly, you must make sure that you've got people with the requisite skills and know-how, especially in the level of financial management. The procurement of goods and services, as I've mentioned, is an area which we are watching with, not only ourselves at the national, working with our provincial colleagues, but also with the assistance of the Auditor General. The procurement of goods and services is very important. Next is the area of human resources, making sure that as much as possible, although with the more constraints of budget, it becomes very difficult to make sure that at all, especially in the front line, you've got the right skills, frontline services in terms of medical staff, nursing staff, pharmacists, physiotherapists, all the professionals, but also in terms of support staff. So those are the three kind of key areas which we will be, watching and working with all our colleagues and making sure that there is sufficient improvement. Of course, clinical management. It's very key, making sure that there's continuous training. We have mentioned in the speech that we now have what is called quality improvement centers, where various of our managers are being taken into training to try and make sure that you can improve on quality.
All right, that's good to know. Minister, there seems to be a renewed focus on the NHI, the National Health Insurance, in your speech. Correct me if I'm wrong. And when we talk about the quality of services, the concern is that there's this future project, and we talk about access to all for health services, but there should already be access for all. Anybody should be able to walk into a public hospital, but people needing help are not getting it on the ground. What do you say to those who think we shouldn't be spending around the future, we shouldn't be reinventing the wheel until we start fixing our hospitals, our public hospitals, right now?
Well, our approach is that we must do both. We must do both. We must fix what is broken. And what is broken, as I would just say briefly, it's basically, one, it's that there is a huge burden on the public health system to start with. If you go to any of our clinics, any of our hospitals, just to give you an example, just after the floods, I was in Durban and I went to the Prince Mshweni Memorial Hospital under a lot of pressure after the floods, with no running water, bringing in water through tankers. But just on that Tuesday, after the Easter, there were, hordes of people all over. And when I inquired about the numbers on average, which they were expecting on the day, just in terms of outpatient services, they were expecting more than 1,500 just in one day, because there's been a long weekend, there's been the floods and so on. But they said even on the normal day, they see more than 1,000, just over 1,100 patients in outpatients. If you go to Krisani Baragwanath and many of, so just the huge pressure on the demand for services is quite a huge pressure in many, even in our clinics. So we need to be able, it's true that in terms of access, people can walk into the primary health services, clinics, primary health centers are all free. But the fact of the matter is that the services are just not enough. We need further expansion. But the reality is that, on the other hand, because we have a two-tier system, at the same time, many of us who have some form of health insurance rely on private health services. That's where most of our income goes into. That takes about half of the GDP spent on health. But that, and so it's a half-half in terms of spending from the general collection from health, private insurance and from the fiscus. But that other half only caters for about 15% of the population. You go into huge hospitals and very nice ones, but you find that there's hardly any activity. So that's the inequity which we're saying. Of course, we must expand and improve on the public health, yes, but at the same time, until such time that there's equity in terms of how all our income which we spend for health is actually subsidized even those who are not employed, we're never going to really reach the kind of quality we're looking for.
Minister, there's so much to discuss. I wish we had more time. But very quickly, talking about the private sector, Charlotte Mangayeke, it took so long for that to be fixed, the emergency ward. It's not even fixed properly, but you were there. And apparently funds from Solidarity and the Spire Fund, I think that's the first rank group, were used. So are things so stretched that no taxpayer money was used? Are we relying on the private sector because of the strain, and how easy was it for the National Department to get involved there?
Well, not to mean that purely we relied purely on private funding, but we appreciate the private funding because the public purse is quite stretched. But going forward, the rest of the rehabilitation of the hospital will be funded from the fiscus, both from the province and also through national allocation. So we will definitely be putting in, the budgeted finances to make sure. But the fact of the matter is, we can't deny the fact that the public purse is quite stretched, and so that's why we always welcome any contribution from private support.
So Charlotte, okay, let's end there. I mean, if you have a head injury and you live in that area, you cannot walk in. When will it be fully open?
The only reason why the emergency unit can't be fully operational, as we said yesterday, is because the CT scan, which is very important in terms of accident and injuries, it's a very advanced X-ray system which can not only look at bones but also soft tissues, including in the brain. If there's a bleeding, any internal bleeding, you will be able to identify through the CT scanner. Now, that is not yet operational because of the fact that just as the unit was getting prepared, some people went in there and ripped off the central processing unit and also some cables, and that is now being repaired and just about to be finished. So the expectation is that by the end of next week, that will be functional, and that's the only major reason currently why it is not safe to get people from an accident scene and bring them into the accident unit. But
all right, Minister, I'm sorry, we have to cut it there because I'm so over time, but we appreciate your time tonight. We were talking earlier about gangsterism and sabotage, and in fact, how sad that it's affecting public health. I hope we can talk in future. That was Health Minister Dr Joe Phaahla.